This is periostal elevator, also known as molt elevator. It is dual-ended instrument having sharp pointed end and the rounded broad end. The concave surface of the sharp pointed end is used to release dental papilla around the teeth by using prying motion, while the rounded broad end is used to reflect a full thickness mucoperiosteal flap. It is held in hand by using modified pen grip style. The main purpose of this instrument is to remove the tissue attachment from the cervical aspect of the tooth. This is called straight elevator. It also has three parts: blade, shank, and the handle. The blade portion is concave from the inside, and this side is usually kept towards the tooth being luxated. The blade portion is connected to the handle through shank. It is usually held in the hand by using palm grip. This instrument is initially inserted perpendicular to the tooth, either parallel or with the blade angled toward the alveolar crest up to 45 degrees in the coronal plane. It acts as a fulcrum and initiates expansion of the socket, disruption of PDL, causing mobility of the tooth, which ultimately facilitates the extraction of the tooth with forceps. This is upper anterior forceps. It has beaks, hinge, the handle. In between the handle is the dental spring. The beaks are usually concave and serrated from the inside in order to grip the tooth and prevent the slippage of the tooth from the socket during the extraction. The beaks are attached to the handle with hinge. The dental spring usually helps the easy grip of the forceps. You can see that the beaks are parallel to the handle, so it can be differentiated from the forceps used for the premolars. Now this is a forceps used for the extraction of upper premolar. It has same parts: beaks, hinge, the dental spring, and the handle. The only difference between the anterior forceps and the forceps for premolar is that the you can see that the beaks are slightly angulated to the handle. This is the only difference between the premolar forceps and the anterior forceps. You can see the space between the beaks. Now the forceps shown is also used for the upper D's and E's. It has same parts: the beaks, the hinge, the dental spring, and the handle. You can clearly see that the beaks are usually serrated and has pointed edges. It is used for a strong grip. It is used in a case when it is difficult to extract D and E with regular forceps. The beak is beveled. I usually prefer this forceps for the extraction of upper D and E's in cases of uncooperative patients because it has strong grip. Now the next forceps shown is BDR forceps. It is upper BDR forceps. It has same parts: beaks portion, hinge, the handle, and the dental spring. You can see that the beaks are fully closed and it has a beveled angled. It is used for the extraction of upper BDRs, broken down teeth. The beaks are concave and serrated in order to hold a root with a strong grip. This is lower anterior extraction forceps. It has beaks, hinge, the handle and the dental spring portion. The beaks are usually concave and serrated from the inside in order to have a strong grip around the tooth. Now this is a forceps used for the extraction of lower D and E's. It has same parts, the beak portion, the handle, hinge and the dental spring. It has serrated, pointed end beaks, and it is used for the extraction of lower D.